Altering a healthy, completely natural part of his creation in such a mutilating way is morally and ethically wrong, as it carries dire consequences for the children involved. Gender transitioning and reassignment procedures can cause side effects ranging from bone density problems to sterilization. Sadly, the most serious consequences for children who undergo a gender transition is an extremely high suicide rate. In one survey study, 2,000 transgender adolescents conducted by the University of Pittsburgh, 85% of the respondents indicated that they had seriously considered suicide, while over half had attempted. While some have stated that undergoing procedures and treatments to modify gender helps with these suicide rates, these treatments are not just unproven, they are dangerous. One pediatrician from the Society for the Evidence of Base Gender Medicine stated that what we are doing now is a massive, uncontrolled medical experiment on children without adequate informed consent and without the backing of any kind of institutional review board. We don't let children get tattoos, smoke tobacco, drink alcohol, use a tanning bed, get a concealed handgun license, buy spray paint, or vote. Why then would we continue to allow children to be prematurely mutilated by chemicals of surgery that puts them on a path of life where they are 20 times more likely to commit suicide?
I'm the father of James Younger, a young Texan who was very nearly chemically castrated and very nearly put on cross-sex hormones where he would have been permanently sterilized. I guess it all started for me when, without my consent, my ex-wife just transitioned my son to a girl. She filed for divorce, and within a few months, just started teaching him that he was a girl. I found out when he was just past 3 years of age. She had started at 2. My ex-wife enrolled my son without my consent in school as a girl. The school began to use his name. She illegally changed his name without my consent. This is all in court documents. These are findings of fact by a court. When I would take my son to school as a boy, Capella Independent School District teachers would give him a dress to wear. Everyone, all of his authority figures were teaching him that he was a girl. I very nearly, in court, after $1 million legal battle, actually over $1 million, prevented my son from going to the Genesis Clinic in Dallas, Texas, where they currently have a pipeline of over 300 children that are prepubescent. I don't know how many pubescent. We didn't get that in discovery. But we know that they have 300 prepubescent kids in the pipeline. I was very narrowly averted having my son sent to that clinic to be chemically castrated. And what I got was equal parenting rights so that I could put a veto on that. The thing that's important about my case to know, and for you lawmakers, is that my son has a very special attribute that you won't see in other cases. He only presents as a girl with his mother. With me at church and everywhere else, he presents as a boy. But the psychologists and the doctors, the schools, and even the CPS agencies, I've endured 7 CPS investigations accusing me of child abuse just because I'm teaching my son he's a boy. All of these institutions have failed to protect my son when there's clear evidence that he's perfectly happy and well-adjusted as a boy. The reason you're not seeing more parents here, the reason that you're not hearing a lot about this, is the family court has actually put me under a gag order, which restricts me from speaking to you, from speaking to my legislators and petitioning my legislators for a redress of grievances. And it also prohibits me from, in many ways, from exercising my religion regarding traditional Christian views on gender and sexuality. But I'm not following that gag order today because I believe I have a constitutional right to speak to you, but I want to let you know that this is why you're not hearing oftentimes about these cases. Not one single institution in this state protected my son. Each child represents a $1 to $2 million income stream to these clinics. Once they go onto cross-sex hormones, they are lifetime addicted to those.
You should be concerned about the profit motive clouding people's judgment. To begin to get a handle on the economics of what we're talking about, our organization, we tracked GoFundMe requests for the last 4 months for what's colloquially known as top surgery. As of last week, we found 40,013 campaigns over that 4-month period. If we conservatively estimate the cost of that surgery at $10,000, and that's a conservative estimate, then these patients will need $400 million to get these surgeries. And that's only a small part, right? That's one of the surgeries. That's a small part of the whole picture. Puberty blockers cost $20,000 per year per patient. Now, given the Williams Institute's estimate, and that's an advocacy organization, given the Williams Institute's estimate for the number of patients who need those those puberty blockers, we're talking about a $3 billion a year business. Given other estimates from the census, the total size of the industry could be well over $13 billion. So there's a lot of money at stake here. The bottom line is this, that if we want to be compassionate and really help patients, the studies show it isn't the drugs that do that. It's proper psychological support and counseling, and especially for minors, allowing puberty to continue.
Now, this may be unpopular for some of the Republicans here, but I'm going to champion the Democrats here. In 1993, I believe, the Democrats in this state very wisely interfered in the parent-doctor-child relationship and ended the barbaric practice of electroshock therapies on children. And this was a very wise thing. Electroshock therapy on kids is making a resurgence, being done primarily to minority children now. But because the Democrats wisely stepped in and stopped that, that won't be a problem in Texas.
Dr. Clifford Allen Hopewell. I'm actually the senior clinical neuropsychologist in the state of Texas, and that I'm the past president of the Texas Psychological Association, 2004. As a doctor myself, one of the issues that has come up with this entire question is the ability or the willingness or the restriction of the state to interfere in the doctor-parent, doctor-patient relationship. And that is a valid question. We're all concerned about that. But I assure you, as a doctor sitting here today, there is no minute of my practice, there's nothing I do in my practice, there's no aspect of my practice that isn't regulated by the state, by the government, to ensure that the practice is done correctly. And the state has a vested interest in many aspects. For example, I can't have a parent come into my clinic and tell me that they want certain treatments or medications or something for their child that aren't appropriate or against regulations or standard protocols. So the government is every day involved in this. My training was at the University of Texas Medical Branch in Galveston, where I was actually the chief psychology resident for the sexual transition teams down there. I've also dealt with this. I've been on 2 medical faculties, run several inpatient psychiatric hospitals. Affirmative care means validating what the person is presenting. We don't do that with any other diagnosis. If an individual is depressed, I don't treat them and make them more depressed and affirm their depression. If they're schizophrenic, I don't affirm their schizophrenia and make them more schizophrenic. Over a number of years, we have documented that children simply cannot make decisions that are life-altering like this. They don't have the capability. The frontal lobes develop in the human brain. They're the last part of the brain to develop. The frontal lobes are involved in making rational decisions, seeing errors, correcting errors, and so forth. So children simply cannot do this. But children are really susceptible to suggestion and manipulation.
My name is Jill Glover. I have a master's degree in psychology. Even if for a time a child wanted to be the opposite sex, with appropriate parental coaching, these children became confident in their bodies and congruent with their biological sex. It was never an option to alter their bodies with hormones or surgery. So this is a very recent phenomenon of doing gender-affirming counseling and certainly treatment with cross-sex hormones, puberty blockers, and surgery. Current pediatric gender transition is very much a social contagion. It is a fad fueled by current sex ed curriculum in schools, by Hollywood and our entertainment industry, by social media, as you've already discussed, and a deliberate attempt to profit financially from destruction of our children by certain activist groups and those who would target the innocent and impressionable. Our youth are experiencing higher rates of anxiety, depression, and other mental health disorders. We very must protect children from adults who wish to do them harm from this so-called gender-affirming treatment. When they are of age, when they are legally an adult, in our country, they may do whatever they wish with their bodies.
Activists is to downplay what the data says about consequences and side effects of these treatments, especially puberty blockers and cross-sex hormones. You could even be forgiven for thinking that there are none at all, when in reality, these drugs, and especially at the doses at which they're administered, are quite serious. They have been linked to high blood pressure, type 2 diabetes, excess red blood cell production, elevated cholesterol, elevated blood lipids, weight gain, acne, sleep apnea, infertility, deep vein thrombosis, and pulmonary embolism. Trans patients can suffer significantly lower bone density, placing them at serious risk of osteoporosis. On the surgical side, one recent study showed that the average gender-affirming surgery resulted in multiple complications and revisions or additional surgeries.
The reality is that the suicide rate is after the patients go through all the transitioning care. What you'll hear frequently the children are at risk for suicide if they don't do this. We've never documented a prepubescent or an adolescent child committing suicide because they could not receive sexual cosmetic surgery, or because they couldn't receive the drugs. A psychologist in Canada was publicly advocating for children to lie about this particular issue. This psychologist is Wallace Wong. And Wallace Wong, this is a quote, he says, "See what you need, and what you need is to get everybody to agree for this care, the doctors and the parents on. Pull a stunt, suicide, every time. Then they'll give you what you want." The threat of suicide is not really a threat. It's never really been documented. And it will be used sometimes to manipulate other people for this issue. Now we come to the crux of the issue of the bill. As I understand it, what is the long-term outcome of children who are subject to sexual surgery or castrated or drugs before they're at the age of majority? What is the problem? What we found is that recently there's another group of people emerging called detransitioners. And these are people who have basically gone through surgery, drug treatment. This is illustrated by the case of Tavistock Clinic in Britain, the National Health Service. And these folks realized that they were injured as children. There are now hundreds of them.
This is another one of those issues that we find ourselves entangled in, that unfortunately the damage is to our most precious being, our children. This bill specifically protects, or is targeted to protect, those that have not reached the maturity to understand what is being proposed, nor the impact on them in perpetuity. It's not reversible. For those that ask why we need to do it, because it is life transformational and life changing. We make laws to protect our kids every day. We've done it for years. Giving children these drugs, we're setting a path for them that they have not chosen, and a path that they may never be able to reverse. These guidelines are described as pro-transitioning doctors as arbitrary, flexible, and yet to be clarified. In fact, it's troubling that most doctors in the U.S. who perform these surgeries on children believe the age requirements set forth by the World Professional Association for Transgender Health, WPATH, which sets the standards of care for transgender individuals, should not be strictly adhered to. WPATH advises that genital surgery should wait until a person is at least 18 years old, right? This is literally changing the body physically and mentally with drugs and surgical procedures. We wouldn't allow this to be in any other area of conversation except if it not for, unfortunately, some of the politicalization of some of this information.
Electroshock therapy. It was invented by the Russians. They exercised this on their bad citizens that just didn't quite get it. Psychotherapy picked that up as treatment, and it became part of psychotherapy, treatment for psychotherapy. Well, in 1993, the legislature saw this as a problem. They were doing this on children. They passed a bill, signed into law, banning electroshock therapy on children 16 and under. We live in a day and time that if you left your dog in your car with the window cracked and it was 72 outside, people would be pretty upset with you for treating your dog that way. And we have children going through permanent, barbaric surgeries. That's the only way I know to explain the gender modification of a child is permanent and barbaric.
I want to address several persistent and misleading claims that are heard and repeated so often that we're apt to believe they're true just because we keep hearing them. So myth number one, the science is settled in favor of treating gender dysphoria and transgender patients with drugs and surgery. The truth is that in the past, very few people have identified as transgender. Thus, many of the studies on the issue have very small sample sizes and no controls. They are mediocre science at best. The burden of proof is always on those who advance radical procedures and new modes of medicine to demonstrate their efficacy and their safety. That has not happened, not to any significant degree, and certainly not to the degree of settling the science. Myth number two. Without access to puberty blockers and cross-sex hormones, trans people will commit suicide. You've all undoubtedly heard this. The truth is that multiple studies show that there is no statistically significant difference between patients who receive, on the one hand, drugs, surgery, and psychological counseling or psychological support, and those who only receive psychological support. In other words, the psychological support is doing all the work. In fact, multiple studies have shown that over the long run, those who transition have increased rates of suicidality, not decreased. Myth number three, puberty blockers and cross-sex hormones are safe and effective treatments. The truth is that the use of puberty blockers has significant adverse effects on health. And cross-sex hormones, especially in the doses required, are associated with a host of adverse health effects. As one patient stated it, the blockers aren't a pause, but a push down a dangerous path that leads to a lifetime of health complications.
My opposition is primarily because I feel this bill intrudes on decisions that should be better left to patients, their parents, and their physicians, not the state. I think it's important to know that being LGBT by itself is not what leads to increased suicide rates, but rather it is the societal stigma and shame, rejection, bullying, and violence against LGBT people. It's the societal stigma that can lead to increased anxiety and depression, which can then lead to increased suicide.
When I was 14, I realized that there was something different about me. I knew I wasn't a girl, but I didn't feel like a boy either. When I finally found the language to describe myself as non-binary, it felt like a relief. But I still felt uncomfortable in my own body. I struggled greatly with gender dysphoria, a feeling like my body did not match who I am on the inside. I fell into a deep depression and even struggled with behaviors of self-harm. Finally, at age 17, after a year of waiting, multiple disheartening delays, and many, many discussions with my doctors to determine that this was the right choice for me, I received gender affirming surgery. The first time I was able to get out of bed post-op and see myself in the mirror just wearing a regular t-shirt, I started crying. I was so unbelievably happy. I felt like I could finally recognize the person in the mirror. If I was not able to receive the medical care that I did at the time that I did, I can guarantee that my mental health would have continued to suffer greatly. I know without a doubt that if this bill is passed, so many children just like me will suffer mentally and physically. I want other trans children who are going through the same things I was experiencing to have access to best practice medical care. I don't want any child to be denied the same joy and relief that I was able to experience.
I am the father of 3 children, 2 of whom are transgender. The kids and the professionals should decide what treatment is appropriate with the loving involvement of their parents. So I caution you to stay in your lane. Leave medical decisions to the doctors and let them continue to provide best medical practices to transgender kids.